Hey everybody, it's Dr. Aline Potvin, tuning in again for another installment of Wellness Ed Sunday. And today, since we are in February, I figured it would be a good time to talk a little bit about heart health. And I think always a really good place to start is to talk a little bit of anatomy first. So a lot of times when we think about cardiovascular health, heart health, we are thinking about the heart itself. And of course, when we think about heart health or cardiovascular health, we're thinking of that big central pump, right? But what a lot of people don't realize is that you have, this extensive vasculature or extensive network, a large web of vessels that extend off of the heart, obviously, and that's what brings blood to the tissues and back to the heart. What I almost call the second heart, that's how I oftentimes refer to it with my students, that has just as much of an impact on, the health of that has just as much of an impact on your overall circulation. It acts not necessarily strictly as a pump, but it does impart a pumping action. So we have two main types of vessels in our cardiovascular system. We have arteries and smaller branches of that, and we have veins and smaller branches of that. And they meet together at the end in these capillary beds, these really, really tiny vessels that feed the rest of our tissues. Now, the thing about your arteries is that you have a much higher pressure in that part of the system than you do in your veins. So your heart is pumping this blood out to the system, right? By the time it gets to the capillaries, into those smaller vessels, that's when you start to require a little bit more activity on your part to get blood to where it needs to go, which is back to the heart. So you have blood that's sitting in the artery part of the system that's going to be greatly influenced by the pumping impact of the heart. And then you have the veins, which is bringing blood back to the heart to be redistributed and reoxygenated to the lungs. Those veins, the things that you can see closer to the surface of your skin, those are going to be really reliant on the movement of your body to be able to function properly. You actually need muscle contraction to be able to squeeze blood back to the heart. So you have this this large network that in a lot of ways can work on its own, but it's highly reliant on your activity to really function appropriately. So when we talk about heart health and when we talk about cardiovascular health, we're not just looking at the health of that central pump. We're looking at how you can support the rest of the cardiovascular system. So I think for this one, because I'm going to break this into a few different pieces each weekend through the month of February, I'll talk a little bit more about heart health and about cardiovascular health. I think for this one, we'll take a little bit more of a focus on inflammation, because we have this, amazing web of vessels that are distributed throughout your body, taking blood, fresh blood out to the tissues, oxygen and nutrients with it, then taking blood that's been depleted of that back to the heart and back to the lungs to be replenished. But your body can't do that appropriately if there's inflammation inside the cardiovascular system. So if you have inflammation going on inside the arteries, the veins, the capillary beds, that makes it a lot harder for your body to be able to distribute blood appropriately. And that can really impact your tissues. And it's one of the larger reasons, or one of the larger mechanisms behind issues, chronic health issues, and decline of the function of tissues over time. So one of the key things you can do is to support the cardiovascular system is actually to reduce inflammation throughout the rest of the body. Now, when we get more concerned about cardiovascular health, it's oftentimes, from a conventional perspective, we're looking at things like cholesterol. For example, that's something that we track throughout a person's lifetime, and we often get concerned that higher amounts of certain types of cholesterol are going to influence whether or not they're predisposed to heart attacks and things like that. There's an element of truth to that. there's a higher probability of cholesterol being able to make its way into the vessel walls if there is, really, high levels of cholesterol in the bloodstream. However, there's a caveat to that. Cholesterol doesn't make its way, deposit itself into the vessel walls and start building blockages inside the vessels unless there's been damage to the inside of that vessel already. And one of the more common ways that you initiate damage to the inside of the vessel is actually an inflammatory process. Now, what is causing that inflammation is something that's individualized. You have to explore root cause for that person. There's lots of things that can cause damage to the inside of a blood vessel. Inflammation can come from smoking, from other dietary sensitivities, from other disease processes like diabetes, for example. But the bottom line is that cholesterol will not deposit inside the wall of a vessel if there isn't damage caused by inflammation first. In addition to that, the cholesterol that's floating around in your bloodstream is not going to simply make its way into the vessel wall on its own if there's damage. It gets deposited there by white blood cells. There's certain types of white blood cells that will take this cholesterol that has to be oxidized first, meaning it has to kind of go rancid in your bloodstream first before the white blood cell will grab onto it. And then it takes it and puts it into the wall. So there's a few steps, that we oftentimes miss when we're considering how to treat or how to prevent blockages in the arteries, right? You can lower cholesterol, but if there's inflammation going on, if there is, oxidation that's occurring with the cholesterol, and if there is, an immune response going on as well, so white blood cells are elevated for whatever reason, you can have this increased probability of blood vessels being infiltrated with cholesterol. And then, of course, as we all are aware from, what we get explained, when we get cholesterol explained to us, that it will increase the likelihood you end up with a blockage. So it's not as simple. When we talk about supporting the cardiovascular system, it's not quite as simple as making sure that the cholesterol is dropped. And that's something I always try to clarify with people because we can track the numbers, and that's totally valuable. And we want to make sure that people aren't experiencing or walking around with these incredible amounts of cholesterol floating around in their bloodstream. However, that's actually not necessarily even the most important consideration when we're looking at health of the vessels. So, to bring it back to the inflammatory process, the important thing to be able to prevent damage to that blood vessel wall in the first place is to manage inflammation. And we can do this in a number of different ways. Again, this is individualized to the person, so it's worthwhile exploring for yourself, where sources of inflammation from a systemic perspective might be coming from. I find that for people that I work with, a lot of the inflammation that they experience is actually related to their stress levels. So when we get stressed out, we have an elevation of a pretty impressive stress hormone called cortisol. And cortisol has, unfortunately, a side effect of increasing an inflammatory cascade in the body. Now, inflammation in and of itself is not a bad thing. I try to, emphasize that to people. It's important as a means of getting, white blood cells to an area that's been damaged. It's essentially an immune response. And it's helpful when you need to heal up tissues and heal them up quickly. When it becomes a chronic inflammatory cascade, that's when you start seeing things like damage on the inside of your blood vessels. And over time, that can cause cholesterol blockage in the arteries. So to be able to eliminate or to kind of rein in that inflammatory cascade, one of the most important things to do is to help a person be able to manage their stress levels. Obviously, there are certain lifestyle things that you can't change. You might not be able to change your job. You might not be able to change your living situation. However, helping people kind of, I guess, modify how they respond to stress is really the larger goal. And a lot of that can come through, absolutely different types of stress management techniques. Some people respond really well to more formal meditation. Some people like to move their bodies. Some people like to watch comedy shows. Really, that's purely individualized to the person, but being very mindful that stress management is perhaps one of the most important things that you can do to help support cardiovascular health. So managing stress levels is huge. There also is a lot of work that needs to be done with diet, and not necessarily, when we talk about cardiovascular health, you've had lots of trends and fads in terms of, what's good for the body, what's bad for the heart. You've had foods that have been vilified over time, namely things like saturated fats, certain types of meats, oils in general. What we're starting to understand now is that sugar is really a larger initiator of that inflammatory cascade, and it's actually has a much larger impact on overall cholesterol rates. So your body actually produces about 85% of cholesterol on its own. You don't get most of the cholesterol that's floating around in your bloodstream from diet. So it's really, really important to keep in mind that one of the key things that you can do if your cholesterol levels are related to your diet, which they may not be, they might be genetic. Keeping in mind that sugar, if your high cholesterol levels are related to diet, removing sugar is likely much more important than removing things like, steak. So I find it's also really important for people to pay attention to what foods they might be sensitive to. When people have certain food sensitivities, they're essentially walking around with a heightened immune response on a daily basis. And like I mentioned earlier, what is, a hallmark of an immune response? Inflammation. That's part of the process. Your body is consistently trying to heal itself. So removing foods that a person might be sensitive to is really key. Now that can take quite some time. Elimination diets are, emotionally kind of difficult. For some people, they can be, if they have a hard time being able to have access to fresh foods, it can be a little bit tricky to have a successful elimination diet. But that's the process of troubleshooting, with a patient. So it's really, really key to meet those patients where they're at. But this is where, an anti-inflammatory diet can be a really great tool to figure out what foods they might be sensitive to. And by that I mean they eliminate foods for a period of time, and then they reintroduce them to see if their body responds improperly to them. So anti-inflammatory diets can be great as a way of reducing inflammation in general, but also identifying foods that you may want to keep out on a daily basis. So sometimes people find out that rats, that cheese that they love to eat every day on their wrap is actually what's making them, kind of inflamed on a regular basis. The worst one for people is sugar. We're humans. We get really sad when we can't have sugar. But it's things like that, figuring out which foods might actually stimulate an inflammatory cascade much more greatly in you as an individual. So we have stress management as a way to reduce that inflammatory cascade. We have food. I always pay attention to environmental triggers of inflammation. So some people, may not feel terrible every day, but they actually have pretty consistent responses to things like the detergents that they use to wash their clothing, right? Lots of environmental chemicals that we're exposed to can, again, initiate an immune response in that inflammatory cascade. This is going to be a systemic issue, like all of these other parameters that we're talking about here. But it's another, I guess, process that's a process of elimination, essentially. So you have to really bring in your awareness around what your body feels like when you're exposed to certain things, and also be kind of creative about what you'd like to do to be able to find different sources of some of these, detergents and toothpastes and body care products, things like that. Well, that's a really good question. So how does drinking water help with inflammation? Your body relies on water for a lot of different processes, lots of chemical reactions. That's why you require it to live. Without proper water, you can't complete some of those chemical reactions. So you actually end up with some reactions that go halfway through, and those intermediate products of those reactions are oftentimes toxic to the body. So you can have an interruption of chemical reactions that can lead to increased chemical metabolites that aren't good for your tissues. That can stimulate an inflammatory response. Dehydration also will make it difficult for your body to eliminate wastes in general. So, if your body is trying to prioritize the conservation of water, you're not going to be able to remove products of breakdown and metabolism from your tissues, and that will stimulate an inflammatory response. So making sure that you're well hydrated just helps your body do the rest of its job. It allows your liver and your kidneys to complete those elimination processes more effectively, if that makes sense. Anytime your body has chemicals or constituents in it that are meant to be eliminated, but they aren't, that it's essentially irritating to the tissues, and your immune system kind of picking up on, a foreign object, if you will, hanging out in your tissues, is going to respond by initiating an inflammatory cascade. Because that inflammation, if you think about, when you get a cut and then give it a couple hours and it's kind of red and hot around that cut, it's not necessarily infected, but that opening of the blood vessels at that space, and that, sometimes there's swelling, there's fluid that is rushed to that space, that's all for the purpose of opening pathways so that white blood cells and different healing intermediates can get there to heal that cut up. Now imagine you take that kind of inflammation and that kind of opening of blood vessels and increased heat, etc., and apply it to the entire system. That's what happens when you have things throughout your entire body that your immune system has to respond to. So to get back to the original question, making sure that you're well hydrated helps with the elimination of things that your immune system could potentially respond to inappropriately. So just to recap here, we have the reduction of systemic inflammation as being one of the most important things to do to support the cardiovascular system, because all of those vessels have really delicate inner linings, right? Now, to be able to reduce systemic inflammation, we want to make sure to manage stress levels, manage, foods, figure out foods that we may be sensitive to and having immune responses to, but we also want to be mindful of things in our environment that might be initiating that kind of inflammatory cascade. So there's a few different sources. There are more, but those are some of the keys that I will see with people, general population. So I think that's about all we're going to talk about for tonight, but I'll continue this series through the rest of the month of February. So next Sunday, make sure to tune in. We'll probably talk about some nutritional strategies and a little bit of herbal stuff next week too. One thing I do want to mention for those of you that are local is that I am teaching an herbalism course on Thursday the 15th that's actually focused entirely on herbal support for the cardiovascular system. So we're going to be talking exclusively about herbs that we would be using to support the cardiovascular system, both the heart and the vessels themselves. We'll be making lots of herbal treats together in addition to discussion. So I highly recommend that you follow the link that I'm going to post below to make sure you register. If you are on my email list, I actually send out discounted coupons for people that are on my email list. So be sure to go to the website and sign up for that as well. But I look forward to having you all at the class, those of you that can make it to the class on Thursday, and I will see you all again next Sunday to continue this conversation. But take care and have a good night and a good week, okay?